Nearly 2 years of COVID restrictions have been brought to an end in England. Prime Minister Boris Johnson in the Parliament announced details of his government's plan for living with COVID by treating it like any other transmissible illness such as flu. Now, the legal requirement to self-isolate for at least 5 days after a positive COVID test has been replaced by a guidance, which is mandatory isolation rules would end on February 24th. And the day is being dubbed as COVID Freedom Day. Mass testing for the virus has also been scaled back, with free universal testing being scrapped from April 1st. Now, except for the vulnerable groups, by removing COVID curbs, Boris Johnson aims to achieve a faster exit from the pandemic than other major economies.
First, we will remove all remaining domestic restrictions in law. From this Thursday, 24th of February, we will end the legal requirement to self-isolate following a positive test. And so we will also end self-isolation support payments, although COVID provisions for statutory sick pay can still be claimed for a further month. We will end routine contact tracing and no longer ask fully vaccinated close contacts and those under 18 to test daily for 7 days. And we will remove the legal requirement for close contacts who are not fully vaccinated to self-isolate. Until the 1st of April, we will still advise people who test positive to stay at home, but after that, we will encourage people with COVID-19 symptoms to exercise personal responsibility.
Now, what could potentially turn out to be a risky gambit, Johnson government declared that it is time for the public to take personal responsibility for their health, rather than relying on the state. The Prime Minister has said that he does not want people to throw caution to the wind. However, the government has also said it would retain some of the surveillance systems and plans for contingency measures. Now, if new variant appears, some scientists have called it a risky move that could bring a surge in infections and weaken the country's defences against more virulent future strains. Medical experts and labour unions too said that it was simply too early to consider scrapping COVID curbs. UK's chief medical officer and chief scientific advisor also expressed his concern and said that the pandemic is not over and the removal of COVID-19 curbs will lead to increase in hospitalizations. Listen in.
Very clear this pandemic is not over and it's carrying on around the world and we're not out of it here yet. The virus is continuing to evolve. So every variant is an evolution and the virus has got a lot of room to evolve. And it will continue to do so quite fast, probably for the next couple of years. Those changes will alter the properties of the virus. There is no guarantee that the next variant is as reduced severity as Omicron. It could be the same, it could be more, it could be less.